Now let's move on to peptic ulcer complication. Welcome everybody to the wonderful episode of Sal's Classroom. The chronic peptic ulcer disease patients would have upper GI bleeding, perforation, and obstruction, which occurs mainly in H. pylori associated and NSAID induced ulcer. These constitute most serious and life threatening complications of peptic ulcer. For few, 10 to 15% of patients have extensive erosion of the ulcer, which can lead to excessive bleeding, which is associated with erosion of arteries and veins. Some patients are asymptomatic, some are symptomatic. The bleeding can be found as melena, that is black stool, hematemesis, that is vomiting of blood. Previously, we have discussed that NSAID can cause GI bleeding, which may be associated with ulcer. The incidence of perforation is increasing with increasing use of NSAIDs, and thus the use of NSAIDs should be limited for such patients. Death has also been reported in patients who continue to bleed or in those patients who rebleed after the initial bleeding has been stopped. The mortality is usually higher for perforated gastric ulcer than duodenal ulcer. Approximately 7% of patients with peptic ulcer disease will have ulcer-related perforations into the peritoneal cavity. The pain may be sudden, sharp, and severe. Begin first in the epigastrium but quickly spread over the entire abdomen. The epigastric region is the upper central portion of the abdomen. Most patients experience ulcer symptoms prior to perforation. Old-age patients who have ulcer and perforations are asymptomatic. Thus, they should be checked for NSAID-induced ulcer for preventing further complications and death. The situation becomes worse when the ulcer burrow into adjacent structures such as pancreas, biliary tract, or liver, rather than just opening into the cavity. Scarring or edema of the duodenum or the pyloric pathway can lead to gastric retention. This may lead to gastric outlet obstruction, which was found in 2% of patients with peptic ulcer. The symptoms of gastric outlet obstruction usually occur over several months, which include bloating, anorexia, nausea, vomiting, and weight loss.
Thank you one and all for patiently listening this session. Have a nice day. Stay tuned to the next session.